Hello, welcome to our frequently asked questions. Today I'm answering a frequently asked question about blepharoplasty. When can I return to work after lower blepharoplasty or lower eyelid surgery? This is a common question that patients ask me, and in answering this question we'll talk about the average time of recovery and how long you should take off work and how your profession may be relevant to that. We'll talk about how you will look 1 week after the surgery and what measures you can take in order to enhance your recovery, to give you the fastest possible healing and enable you to go back to your daily activities as soon as possible. My name is Dr. Julian De Silva and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I complete for my patients, and the information that I'm discussing with you today is information that I share with my patients on a daily basis. So first of all, what is the average time of recovery after lower blepharoplasty? Well, the average time that I advise patients to take off is 2 weeks after lower blepharoplasty. And for most people, the majority of the recovery will happen over the first 2 weeks. And so that is sufficient in order to go back to work for most professions. If you work in a profession where there's a lot of HD cameras or video footage, well then I would generally recommend a minimum of a 6-week period just to allow further swelling and further recovery to take place, to ensure that those cameras, which hide very little detail, you'll feel comfortable and relaxed about doing your profession in a normal way. So let's now look at how will you look 1 week or 2 weeks after the surgery in terms of your recovery. Well, the three main aspects of recovery are swelling, bruising, and any scar. And so swelling, well, generally 80 to 90% of all swelling will go in the first 2 weeks after surgery. And yes, there are some exceptions to this. If you have certain medical conditions such as thyroid eye disease, well, there may be a little more additional swelling that will take longer to resolve. But for the majority of patients, most of the swelling will be gone between the first and second week after surgery. The second aspect is bruising, and most patients don't have a great deal of bruising after lower blepharoplasty, but this is certainly a part that is technique dependent, and if you need additional techniques with lower blepharoplasty such as fat transfer, well, the chance of bruising is between 10 to 30%, and so a third of patients may have bruising, and most bruising is relatively minor and can be covered with camouflage makeup. But rarely there can be more bruising, and bruising, complete resolution of bruising usually occurs by the end of the second week, but can take as long as 6 weeks in rare cases. However, camouflage makeup can be used before then in order to conceal this. The third aspect is scarring, and this is very much technique dependent, and when I complete lower blepharoplasty, more than 90% of the time there are no visible scars. I use a scarless technique where the scar is hidden on the inside of the eyelid, which means that even a week after surgery there is absolutely no scar to be seen. However, certainly worldwide, there is still the more conventional technique that does involve a scar in the lower eyelid, and any scar that is completed with lower blepharoplasty will be a little bit pink, it will be a little bit lumpy bumpy, and it will take some time in order for that to resolve. Generally most scars heal well, however no scar heals instantaneously, and it can be several weeks before that scar is relatively fine and difficult to see. However, again, it can be covered with some concealer makeup. Let's move on to what measures can you take in order to ensure that you have the fastest possible recovery. Well, first of all, there are measures that you can take before surgery, and so there are certain medicines which include prescription medicines such as aspirin, herbal medicines such as fish oils. Well, these really can thin your blood and increase the chances of bruising and swelling, and I give all my patients quite detailed instructions on how to avoid this for 2 weeks before and after the surgery in order to ensure you have the fastest possible recovery. In addition to this, if you suffer with any medical conditions, for example high blood pressure, well, it's very important that your blood pressure is well controlled before the surgery, as this will ultimately ensure that you have the fastest possible recovery and minimize any chance of bruising. In addition to this, surgical technique is of substantial importance in order to define how fast your recovery will be. And completing lower blepharoplasty on the inside of the eyelid, termed transconjunctival blepharoplasty, well, this hides a scar and gives you a much faster recovery, and this is a technique that I would prefer for most patients who come to see me. However, the more conventional way of doing the surgery through the skin, called transcutaneous surgery, well, this can give you a more visible scar and will take a little longer for this to heal. In addition to this, well, other measures can be used in order to speed up your rate of recovery, and these include meticulous technique in terms of reducing bleeding, the use of state-of-the-art technology, including electric cautery, including platelet-rich plasma technology, which uses your own growth factors to heal parts of the eyelid faster, and so you have a faster recovery from lower blepharoplasty. So choosing your surgeon, well, I would take time and invest in this in order to ensure you have the fastest possible recovery, and there are measures that you can take, such as researching your surgeon, going for consultations and discussing various aspects of the surgery in order to ensure you have the fastest possible recovery after surgery. After the surgery, two important aspects are following your doctor's instructions, and I give all my patients quite detailed post-operative instructions, and these are important because all these are designed to enhance your healing and speed up your recovery. And I find in my patients who follow these instructions, for example avoiding exercise in the immediate week after surgery, well, these patients heal much faster than patients who take it in their own hands and do things slightly outside the instructions advised. In addition, things like using cold compress the first 3 days after surgery, well, these will definitely reduce the level of swelling and enhance the recovery from lower blepharoplasty. So in summary, well, we've talked about what the average recovery time is after lower blepharoplasty and when you can return to work, which is generally 2 weeks after surgery. We've talked about exceptions to that, including certain professions where high-definition cameras are required. We've also talked about how you'll look 2 weeks after the surgery, and we've talked about measures that you could take in order to speed up your recovery and give you the best possible result from lower blepharoplasty. I hope this information has been useful for you. Thank you for watching.